Hi, Amy Van Arsdale here, and I am here with Dr. Ann Abram, and we're in Norwalk at her psychotherapy practice. Thank you for having me.
I'm so glad you're here. Thank you for coming.
Well, thank you for having me. I'm glad to share. I think the number one question people may ask is, what problems do you treat?
I treat a wide spectrum of problems, and it goes with a wide spectrum of ages. So I see mothers and their babies. Perhaps they're having difficulty bonding for whatever reasons. I see parents of adolescents and even young adults. And then, of course, I see adolescents themselves, and I see young adults themselves. I see adults who are having marital problems. I see a lot of people who come in for reasons related to trauma or PTSD.
And so really, because my next question was going to be talking about age groups, and it sounds like you don't just specify one age group, which some psychologists do that. And so what are the benefits to be able to see the whole spectrum?
I think it's really important to be able to see the whole spectrum because, of course, different age groups have different developmental needs. And when you put a family together, it's good to have the full picture and to understand what these developmental needs are. So, for example, a 5-year-old in a family has very different needs than a teenager. And if you have some sense of this, then you're able to help whomever is in front of you better.
And what would you call your style of practice?
My style of practice is very eclectic. And when I have someone in front of me, I try my best to put myself in their shoes and understand whatever they came in for from their perspective, from their point of view. And with that level of, let's call it empathy, I make decisions as I go along as to what would be the best method to work with this particular person. And I really don't like to see it as a method because, I think that all my training is combined and is internalized within me. So it's almost as if it's in my DNA, so I don't really think about what method I should use unless it's something very, very specific, like horrible trauma that really needs attention in a different way.
Well, thank you so much for your time. It's fascinating in a business that I don't know too much about, but I'm fascinated by it. It was so nice to see you.
So nice to meet you, Amy. Thank you for coming.